The pandemic has demonstrated the urgency to take critical steps in strengthening emergency preparedness in order to prevent future crises. The WHO is uniquely placed to coordinate global efforts through democratic governance and international solidarity. The WHO's role in health emergency leadership needs to be consolidated, including by securing sufficient funding. The World Health Emergencies Program serves a vital role in global health, but is severely underfunded. Adequate, sustainable, and untied funding by increasing assessed contributions and decreasing dependence on earmarked voluntary contributions is critical. The WHO must shape its priorities based on science and urgency, not on the agendas of donors, whether powerful countries or non-state actors. We are concerned of violations of human rights in the name of responding to COVID-19. We urge the member states to amend the international health regulations with an explicit reference to Syracuse principles to clarify that even in emergencies, the right to health cannot be pitted against other rights. We recognize the WHO's efforts to adjust the IHR to facilitate member states' compliance. However, IHR cannot be viewed in a vacuum and must consider the robustness and level of development of countries' health systems. To ensure a shared responsibility among countries in preventing disease transmission and avoid imposing a disproportionate burden on low and middle income countries, financial and technical support to member states for IHR compliance is required. The IHR Review Committee should uphold standards of transparency by publishing participants' names and organizations, including for non-state actors. Increasing access to innovation is critical during health emergencies. We welcome the WHO's support for the TRIPS waiver and urge member states to endorse this measure. We call for a strengthened CTAP mechanism based on binding principles of ABS and urge member states to license publicly funded COVID-19 technologies through CTAP. Pharma companies' lack of participation in solidarity trials leaves us without comparative data on existing vaccines. The member states and the WHO should address this gap.